and also the captions. Okay. Good morning, everybody, and Happy New Year. Welcome to the January session of the Disabilities and Conditions of Aging Network. Based out of central Indiana, although sometimes we have people from other states join us or from national organizations. Though more often than not, it is just folks from central Indiana and maybe a few other counties a little bit further out. It is a pleasure to see all of you. Again, Happy New Year. And if you are new to the group, it's a fairly casual format. We simply go around, share updates about what's going on that, in our particular little corner of the disability community or things that are affecting all of us at larger levels. This is a great opportunity to simply be open and talk about anything that we need to explore partnering together on, whether we're talking about advocacy or we're talking about helping simply promote opportunities for our fellow people with disabilities within our community. Um, that said, I'm Jeremy Warner. Walking Spirit is my organization. I have a beard because there's lots of snow on the ground, and that will stay that way until we get above 60 degrees. And my what Walking Spirit does is accessible DEI consulting and support, public speaking, coaching, and what I like to call quality of life advocacy and adaptability coaching for people with disabilities. That is really about connecting people with disabilities with all of you, the resources that are there to help support them, to help them on their journey to independence. And that said, I will say this: anybody who's been paying attention to the news, I am not rebranding my business because of the attacks on DEI, both within our state and at a federal level. And I believe that part of why DEI became so attacked was because they didn't focus on accessibility and including people with disabilities in those programs when they began. And so that is very much what Walking Spirit is about helping businesses and organizations recognize that people with disabilities are part of diversity. And just saying diversity doesn't necessarily include that unless you are intentional about it, and that people with disabilities cross every other demographic. So if we're going to have diversity, equity, and inclusion goals, we have to start by making certain everybody can get in the door to access the program, and that program is accessible. So that's me. That's what I'm doing. The only other couple things that I have to add, and then we will start moving around the board. I have been emailed by multiple people this week, starting with Sonia, about a great opportunity for any amputees who meet the qualifications, lower limb amputees who need to have a residual limb that's at least 24 inches long, to participate in a research study that the University of Indianapolis is doing on a piece of equipment that can really hopefully improve gait. And so I will post some information about that into the chat. There also, if you were just coming on right at the beginning or right around 10 a.m., Sonia and I were talking about the fact that somebody who we are close to has identified that over the last couple weeks, several links for resources that they have gone to and utilized are no longer functional. And we don't want to make any assumptions about why that is, but just to let folks know, um, the indierent.org page has been taken down. The second IHA portal is not working. The Indianapolis Housing Agency important notices apply for housing button no longer works. The that portal again is not working. So you can't find the page, and there are several links for affordable home loans through Merchants Bank that are no longer functioning. And then they also sent me a link that Braun calls Medicaid a broken program, which, if you've been on several of our meetings over the last, half of 2024, hopefully you have heard Carly's updates about what's been going on with the Medicaid redesign, restructure. And so apparently our governor is defending an order to stop advertising Medicaid. I believe everybody here knows how vital those programs are, even if it's not functioning as well as it should. And so 2025 is probably going to have a lot of advocacy work that we may not all need to start coordinating on together. And this network was always intended to bring the disability community together so that that actually is something. And it depends on where you are in this state, whether or not there is a strong disability community in your area. I would love it if through the work of this network and other organizations like InSilk, that we are able to actually unify that community and find the strength in our voice, being the largest minority in the world that tends to be the least represented. So, that said, I am going to pass it on. And if anybody, again, use the chat to put your information in, your contact info, any links, any upcoming programs, use that because I will send it out to everybody. And there are 120 different organizations that get invited to this every month. Um, so they get this whether or not they're here. So please put that information in. And that said, I will ask. Oh, yeah. Also, put in the chat if you need to go or notify me if you can't be here for the full length so that I can get to you before you have to leave. Um, so, that said, I'm going to start with Tim Verman today. Tim, how is your corner of the world and what's going on from the Methodist Church disability advocacy support standpoint? And I think I just got all of that wrong. So go ahead.
Well, it's cold here,
Yeah.
like it is everywhere, uh, which means that my newly reconstructed wrist is giving me all sorts of trouble. Um, I can't remember what on earth it was that I wanted to talk to you about. I emailed you earlier today about that. It's still escaping my mind.
Oh, that would be the program that UIndy is doing, that research study. Yeah. You
Okay.
emailed me about that. You were number 8. Thank you.
And I think that's about all I know at the moment. Both of the groups I would represent perhaps are having organizational meetings in the next few days.
Okay. Well, if there is anything, you know, I always find it interesting that religious organizations are exempt from the ADA. And
Yeah,
so when there are disability focused groups within religious organizations advocating again for them to be accessible to everybody so people can participate in aspects of faith. Um, I think it's very important that you be involved in this network and these conversations. So,
there is an amendment to the National United Methodist Constitution that would reinforce the non discrimination policies of the ADA. in the church.
That's good to know.
We'll see how it goes.
Okay. Please keep us updated on that. Um, all right. So, next person, Jessica Garber.
Hi there. Um, so I am with Connections Case Management. I'm the marketing director here, and we do Medicaid waiver case management. I know a few of you on the call, but several of your faces are new to me. So we provide Medicaid waiver case management services to people with intellectual developmental disabilities. So they're on the family support waiver, the community integration habilitation waiver, and we also provide supports to people with medical complexities that are on the health and wellness waiver, as well as the traumatic brain injury waiver. Um, I don't have a lot to report today other than we are continuing to partner up with Self Advocates of Indiana, a nonprofit agency here in the state. Um, we have been providing resource fairs over the last couple of years, and as part of the IPP program, the grant that was funded to us from the state, um, we are working in partnership to hand the reins over to Self Advocates this year. So this is going to be their first run at trying to take care of this themselves, with us in the background supporting them now. So this is their first year to do it themselves. So I'm going to continue to support them in terms of letting people know about it. So we have the first three events up for this year. We're going to be going to Evansville, South Bend, and Indianapolis. Those are already scheduled, and I put those in the chat already. There's a link if you're interested in registering to be a participant as a vendor. And then we will have two or three more in the fall for other areas of the state as they're trying to continue to ensure that we're reaching out to all areas of the state and providing those necessary resources to people in the community.
Okay. It- Anybody who's new, also, please, if you have questions, feel free to jump in. I have a tendency to keep us moving, but want us to go down whatever rabbit holes people need to go down. So, any questions for Jessica at the moment? Any questions for Tim? Because I didn't give that up when he spoke. So, okay. Heather Wildrick Holman, would you like to jump in?
Good morning, everyone. My name is Heather Wildrick Holman. I am with Firefly Children and Family Alliance. I'm the assistant director of our prevention program in Marion County called Community Partners for Child Safety. There's a program like ours all across the state of Indiana. I always like to share that map in the chat, and I will do so again today. Essentially free and voluntary in-home case management for all caregivers of children 0 to 17, connecting them to various resources to keep their family happy, healthy, and strong. We accept referrals from folks who self-refer, and then we accept referrals from really anyone. So I wanted to give that quick little update. We just found out literally, I think Tuesday, that we were in kind of our contract renewal period, and we did get all of our regions that we currently serve in the state renewed. So we were pretty excited about that. And then we added a new region. It's Region 6. If you work in this world at all and you're familiar with the region clusters, you'll see that on the map. So we'll add to our the communities that we serve starting July 1. Tina Clore, our executive director, we with our merger many years ago, from not many years ago, a few years ago, of Children's Bureau and Families First, she did some restructuring internally of our organizational structure that freed her up to do a lot more time and doing a lot of lobbying work at the State House. So I anticipate hearing some interesting updates from her on Tuesday. One of the things she shared with us that I don't know that we were officially told we could share with the masses, if you will, back in December was, I don't know if I missed December's meeting, but I'm going to misspeak and I won't say it as well as she does, but the child care voucher program, we hold a great number of the county's contracts, and we serve a great number of folks in the state around the child care voucher program, CCDF. So the funding is messy there. They've ran out of funds. So they have had to go back to a wait list. We are frustrated as an agency because people are going to miss kind of like point fingers at at us thinking like we're the problem, but it's not us. We're just the contracted provider to, provide that service. Um, but what I have been told in whispers essentially is they're going to do, I think, things like we're going to see in other both federal programs and local programs where they're going to make it a lot harder. They're not going to give as much grace to folks who maybe miss a deadline or don't have all the exact paperwork, I think, and you're going to fall off. So we're going to see this wait list just really, really grow, sadly. I share that building with my program, and CCDF shares that building. It's just kind of heart-wrenching to watch folks, just the look of crisis on their face when they lose this important thing that they need to be able to go to work or do it, et cetera, the child care voucher funds. They're just going to be, a lot more making sure every T is crossed, every I is dotted with this. They're hoping to just kind of like free up and clear the role, if you will, or the rosters, if you will, just by people not turning in what they need to turn in and things like that. But I did want to put that on folks' radar if it wasn't already on your radar. It's not my program specifically, so I'm not as well versed in it as maybe another person from CCDF would be, but I wanted to share that with you. I was trying to find an article to share in the chat, but a lot of them are behind paywalls. So if I can find one that's not behind a paywall, I'll be sure to add it. Indy Star has put out something, and a few others. But anyway, I'll be quiet now. But yeah, thanks. Always glad to be here.
You're absolutely fine. And if you come across any articles that aren't behind a paywall after the session, please email them to me. I will send it out to the group. And and that is something I try not to send you guys a whole bunch of emails all month long, but anytime any of you have something that you want to share with the network, please email it to me. I will forward it on to make certain that everybody gets a chance to see it. So, um, that said, any questions for Heather? Okay. Adam Brainerd, I feel like the last few times you've been on, you have had to leave before I've had a chance to call on you. So, would you like to jump in, say hello, tell us what's going on in your little
You're
corner?
getting to me early. Yes, I did last time. Sorry about that. And yeah, hi everyone. My name's Adam Brainerd. I work for CareSource. We're a managed care organization. My team is called Life Services, and we are focused on the social determinants of health. So we do a lot with employment, housing, et cetera, for anyone on one of our plans. Trying to think. In addition to that, separate from CareSource, I also am on the board of Indiana APSE. So if anybody has questions about that, it's employment focused Association for People Supporting Employment First. Um, yeah, I don't know what else to say. Sorry. Does anyone have any questions?
That's fine. Any questions for Adam? All right, that's okay.
All
Just
right.
simply being here is I believe important so that everybody can find out more about our community. So, Jamie Olson, speaking of the community, tell us about Uniquely You.
Hi guys, good morning. So glad to be here. Jeremy, if you would mind, I would love to show you guys a really cool 1 minute video. If I have the ability to share my screen. Um, in January, we featured on the issue the Best of All Band, and we got a video of them, all the band members from Gigi's Playhouse, receiving the copy, and just the pure joy on their face of seeing themselves celebrated and recognized was just such a heartwarming moment. And I think really summarizes the impact that this a great monthly resource offers the special needs and disability community. So I'm going to share that quick video with you guys. But before I do, I did in the chat box put details that are coming up for our New Year's Bash that we're doing on February 1st, next Saturday. And we're super excited to put this event on. We've done it every year. And this year we've actually changed locations from Greenfield out to Castleton, so much closer to central Indianapolis. and we're doing it at the Haverstick from 2 to 5. And we do have a couple more spots available for individuals with disabilities that maybe they have a talent, maybe they like to dance or sing or play an instrument, and they want to come out and perform during the talent and variety show at our New Year's bash there. So you can register. The link there is as well in there if you want to attend. We do plan on having like face painting balloon artists, different food assortments, and some really cool dessert spread as well. So it'll be a fun event. We'll do a kind of fun get to know you bingo as well, and we're thankful to Connections Case Management and Jessica Garber, one of our partners, who will be there to help give away. We're going to do some raffle prizes for the winners of that get to know you bingo. So we're super thankful for that. So if you want to register, the links and the information are in the chat box, and you're welcome to share with any of your immediate network who would see value in being a part of this really great event that we're doing on February 1st. So I'm just going to share. Oh, it says I need to send a request
There you go.
for you
We're
to give
good.
me sharing privileges. Perfect. So let me just pull up the right screen here. Have it pulled up. Awesome. And then I'm going to share my sound so you can hear it. It's just a quick minute.
That's fine. Take your time.
Oh, come on, video. You worked for me yesterday. Oh, don't do that. Having issues. Gotta refresh it. There we go.
Festival band, you've worked really hard. You've done some absolutely incredible things, and I have something very, very exciting to show you. Festival band, here is your magazine. Whoa! Nick's going. I know. Here you go. There. Yeah. I am serious. There you are. Embarrassing. Oh, it's me. Oh, it's okay. Okay, so don't make me cry.
Oh my God!
Here, Stephanie, you're gonna get one too.
That was wonderful. Thank you. I think
Yeah, you're most welcome. It's such an honor and pleasure to bring this awesome resource to the community every month and celebrate the community and give them a chance to share their story from their perspective. And just when they see themselves, it just brings so much joy. And it's a free resource monthly for the community, printed and mailed on behalf of our partners. So we're super thankful for their involvement in helping to make this resource available to the community. And super exciting news. We actually rolled out our second training, and we are expanding this great magazine across the nation, but it'll be very, very custom for each local area based on the individual needs in that area. So we actually will have one in Chicago, in Florida, in Georgia, in Texas. We have 8 different locations opening up here in the next few months. So really thankful that the N2 company is willing to help kind of back this and help expand this and provide the support and the training and the printing and the opportunity to impact more local communities and get resources out to families and celebrate individuals on a much deeper level. So very, very thankful. And of course, keep us in mind if you ever need to share your events or want to include them in the magazine. We do have that free section in the back where we put all the upcoming events. So we're working on our April edition for Autism Awareness Month. And so that issue we deadline for on February 20th. So if you have any events that you want us to include in the April issue, go ahead and shoot me over those details and we can happily include them for you.
very cool. Thank you so much. Any questions for Jamie? No? Okay. I'm gonna call on Kristen Ludiker Siebert next, and I noticed that you made a comment in the chat that that was Lindsay. Was that Lindsay Zarin in the
Yep.
in the video?
That was
Okay.
Lindsay Zarin.
Yeah, it's been a long time since I've seen her. So yeah, that's very
Yeah, she's with Copper Z Wellness now and is doing phenomenally well with music therapy in the community. So
good.
if you ever need a good music therapist in your program, Lindsay Zirin is phenomenal and would be happy to help with that. She gets a lot of really good grants to help cover kids with their music therapy programs.
Yeah,
Yeah.
Lindsay's great. Yay, well, thank you. So I'm Kristen. I am the system of care coordinator for Hamilton County. So the nonprofit is a healthier Hamilton County system of care. Um, Thank you, Jamie. Well, actually, no, I'll start with Jamie. Thank you, Jamie, for me sending her an email 2 days late. And she was like, "That's okay, I'll still get it." And I was like, "Yay, sorry, my bad." Thank you to Sonia for meeting with me on Friday because we had a great discussion and that was wonderful. And thank you to Jeremy for starting this meeting off very positively because I'm not feeling positive some days, and I needed this today, Jeremy. So thank you.
Oh, my pleasure.
Um,
I'm not feeling that positive either. So, right there with you.
I, I figure if we have each other, right, we can work it out somehow. At
Hmm.
least we can build off each other's hope. I don't know. I'm trying to figure it out myself. We're gonna figure it out together. So in regards to a healthier Hamilton County, the two big things that actually I'll do two hats. So in regards to a healthier Hamilton County, the big thing we have coming up is on March the 25th at the Delaware Township Community Center. So that's there in Fishers on 131st Street. We are going to be doing we're going to be having an event. It's called Communication, the Eras Tour. My youth named it, and I love it. But it is about communication across generations. And all of our youth and family events start off with organic conversations with the youth involved. And what are those things that they want their adults to know? And this conversation was about communication and how technology, language, there are all sorts of different reasons that it is hard for, like, I have a teenager, right? So it's hard for us to communicate with our teenagers sometimes because literally we're using different words. Or as, those of us who were born before not computers, but like, phones happened, right? We're like, oh, wait, we don't have to talk to people all night long. I can go read a book and go to bed. And that is like beyond like my teenager's capacity for understanding that you can actually stop talking to people and you don't have to answer them if they send you a text. So just those types of things. And then the last part of it is about individual perspectives and how even though we can share the same memory, because of our perspectives, we may communicate about that differently. So with I'll put a link in the chat. With the invitation, we would like whoever signs up to bring someone in their life of another generation. So we have a youth, for example, who's bringing her mom. So the first exercise or the first activity will be about language. We're going to do a fun Kahoot game where we've written, it's all about slang words. So slang words from like the 90s and early 2000s versus slang words now, and kind of how that has changed over the years and, how that can sometimes block communication. And we're going to talk about technology and communication. And then in the last part, we're going to talk about that individualistic perspective piece, but we're going to have each pairing create their own like scrapbook storybook. So come up with a memory that you both have, like you're both at the same thing, maybe a family vacation. But then, the young person, for example, kind of scrapbook on how they remember it and why it was, fun and important to them. Then have the parent, do the same thing to see that, yes, there was the same event, but different pieces are going to stick out for you based on your perspective, and you're going to communicate that differently. So again, March 25th, Delaware Township, completely free. Dinner will be provided, and I will put that link in the chat. So please share that forward or come or whatever you would like to do. Anyone is welcome. And then I'm going to take that hat off and I'm going to put on my Recovery Cafe board member hat. So I'm a board member of Recovery Cafe in Hamilton County, which is also in Fishers. And their first fundraiser is coming up on March the 21st. So that's a Friday. It's called Raise the Paddle. I'll put that link in the chat as well. And we are looking to raise funds simply for the like basic needs this year, the basic needs of the cafe. So rent, keeping the lights on, paying for the dinners for the cafe community members, those types of things. So I'll put that information in the chat. I would love if you would share that forward to your agency, if you are, from a larger agency, and see if they would like to be involved with that. Because as we know, number one, everyone is in recovery from something, and that's our tagline, where it doesn't just have to be substance use. Everyone's in recovery from something. Sonia, I'm looking at like your box because this goes back to our conversation on Friday, right? Where we're like, everybody's had something, right? That they need to get over, not get over, but just kind of process through in their life. And then secondly, it's, there's tables available to sponsor, and they can get their name out there to the other members, etc. So that type of marketing thing. So I'll put both of those links in the chat, and I think that's all I have.
Wonderful. Any questions? Okay, that was a lot of information. Thank you, Kristen. I look forward to seeing all of that. So you invoked Sonia a couple times. So Sonia, what's going on with accessibility?
So, we're just getting into the new year. We've got some new members that we're including into our organization. So pretty exciting about that. And also just started a news. Oh, no, I did that wrong. Sorry. Oh. Okay, so anyway, we did a newsletter. I will get that into the chat afterwards, so everybody can see it. It's pretty cool. It's quarterly, I think it is. And so again, I'm Sonia with Accessibility. We help those that identify as disabled to live more independently. We have advocates on staff that help you along your journey. And we like partnering with different organizations and all of the community mapping that's going on. I love it all. And Kristen, yes, it was wonderful to meet with you. And I've looked through those resources. Just amazing, lot of information. And I also would like to connect with Jessica Garber. I think I might have a consumer I can talk to her about. So with that, I think that's all I have today.
Okay. I love hearing about you guys connecting with each other. That is fantastic. So thank you so much. I am going to, what, any questions for Sonia? Nope. Okay. Then I'm going to call on Ashley Dries because I see that her steering wheel is not in motion.
Correct. Can you hear me now?
Yes.
That better? Okay. I am Ashley Dries from Purdue Extension J County. And as I was explaining, but you couldn't hear, I was directed to your group from or by Shalicia Howard from CareSource.
Okay.
Because I was in a recent suicide and overdose fatality review where, and I'm kind of opening this up to your network, but I learned that it is legal in Indiana to turn a person away based on a physical disability from recovery housing. So this person was looking for treatment for a substance use disorder, and one of our major networks in Indiana said that they tried all over the state. She was held in the ER for 5 days with suicidal ideation. And they said, sorry, we can't take you because you're in a wheelchair. And that's unacceptable to me. So I want to know, what's going on in that space? What can I do about it? Collectively, what can we do about it? What's going on?
Um, so I'm gonna jump in there for just a second. Do you know does Jay County have a Center for Independent Living?
We have we have a Medicaid waiver
Okay.
organization, but nothing big. We are very rural.
So I will look at the map well when we move on to the next person and take a look. But um Centers for Independent Living include advocacy services,
Mhm.
and really it's about teaching people to advocate for their own needs. But in a situation like that, for instance, I have seen accessibility get a wheelchair for an inmate who was literally arrested and taken away from their wheelchair.
Yeah.
And um, so that would be something. I am also, since that falls into the accessible part of diversity, equity, inclusion, and belonging. So if you wanted to send me information about that, I would be happy to reach out to them to
Okay.
talk about how we include everybody who need those services. And those are vital services. It's absurd to think that anybody would turn anyone away. Um, Without at least finding the alternative and getting that person to the alternative if they can't take them in themselves.
Yeah. This
So,
girl was advocating for herself in every way. She was engaging over and over and over with healthcare networks and systems, but they all said, sorry, we can't help you because you're in a wheelchair. And in 2025, that's unacceptable. So, and I know there's more instances out there than I'm aware of, um, but I need to learn something. So, thank you for letting me sit in today.
yeah, absolutely. Anybody else want to jump in and share their thoughts on other options and how that can be handled? Really,
I
Cricket?
see. I see in the chat, Carlos said that doesn't seem legal to turn a person away due to a disability. They can find alternative meeting spaces if their facilities aren't accessible. So this would have been an inpatient need. So she would have been in like a 14 to 28 day rehab setting. And the official answer that I came to or found was that if they do not provide a service to everybody, then they don't have to provide it for that individual. So if they don't have like a CNA or a patient care tech who can handle like toileting issues or just basic care needs, then they can deny them care. And that is unbelievable to me.
Well, even just sorry, does the person already have these services arranged for, outside of that facility?
She had been to other facilities, but unfortunately, in this case, she is now deceased because they could not find anyone willing to accept her into recovery. So she passed
Oh,
away due to overdose. Yeah.
oh,
And
I'm so
that's
sorry to
Hey,
hear that.
totally unacceptable.
Oh, wow.
I'm Beth, and I'm the chairperson of the Indiana Governor's Council for People with Disabilities. Um, I would like to connect with you
Okay.
and explore if we could be of any assistance and at least advocacy education around this issue.
Right. Do
Um,
you have your info in the chat, Beth?
I do, but if you want to just email me at BADEHOFF as in Frank
Mhm.
at iu.edu. That way you don't have to look for my information. I don't know that I can help, but it's possible that I can start some advocacy around this and awareness around it
Right.
through the governor's council.
What was your official title? I like notes because I will
Well,
forget.
with this hat, it's the chairperson of the Indiana Governor's Council for People with Disabilities.
Okay. Thank you.
Sure.
Jeremy, I want to throw something out that kind of goes with this,
Please do.
that shelters in this weather rarely take people that have low vision or completely blind because they say they cannot take care of them. So I just wanted to throw that out there, that was a thing that I found out that was like, those are the people that need the shelters with their homeless in the overflow, but because it's the overflow, they don't have the resources to make sure they're okay. So I just wanted to put that on top of that.
That's sorry to jump in. This is Carlos. To me as an individual who's blind, just because Now, I understand people may have additional disabilities and needs other than blindness, but if it's just due to being blind, I'm not sure what there may not be a need for somebody to quote unquote take care of the blind person.
Oh.
So I think there may be some wild some misunderstandings on somebody's part there.
There was a lot of fear with liability. And in my case, the individual lived independently. She cared for herself. She did not have any kind of care aid. So realistically, she could have taken care of her own bathroom and hygiene needs. And I would, a lot of the time, like you're saying, Carlos, just because you're blind doesn't mean you can't physically take care of yourself. But they're leaning pretty heavily on that liability component.
I and this is all the more reason why whenever we become aware of something like this, it's important that one, thank you, Ashley, for bringing it up. Two, that when we hear about it, that we follow up with those organizations to actually mobilize our community to make certain that the next person that needs that support isn't turned away. And it's understandable if a facility can't handle certain things, but finding an alternative. You can't just turn somebody out into the cold without finding a way to help them. And sadly, we do live in a nation where we can do that, but we need to try to be better. And so that was the point. So Ashley, please send me the info about that, and I am going to look and see if there is a. I don't know. There are some counties in the state of Indiana that do not have a center for independent living. If you're not familiar with what that is, there are 10 centers throughout the state that serve particular regions, and they are meant to be advocacy organizations first that provide services, independent living services to people with disabilities. And so what that's built around five core services, being both systems level advocacy, advocating for change at that systems level, self advocacy, helping people be able to learn how to use their own voices, but also rallying together to elevate that voice. Um, Independent living skills training, peer support, transition services, and really, information and referral services to help get people to those resources when they're not able to find them. So there are 10, like I said, throughout the state, counties that are not covered. Absolutely, people from those counties can call the closest center for independent living. And if there are virtual services that they can engage with, they can. If there are not, I would recommend anybody who lives in a county that doesn't have a center for independent living to attend the Indiana Statewide Independent Living Council's public meetings and talk about the fact that they need a center that covers them. So, um, Sonia, you want to add anything on that?
You. So, Ashley, you said Jay County?
Oh, thank you.
Correct.
Okay, so Jay County is covered by the league, and I am copying, and the league, which is up in
Fort Wayne.
Fort Wayne,
Yeah.
they cover counties, or they try to cover the counties that aren't covered by a specific.
Right.
So
So
I am putting the league in the chat right there. Their link, and hopefully that can be a first step.
Yeah, that's great. Thank you so much.
Okay.
Mhm.
I think we still have four people that I want to get through in the next 10 minutes. If people can stay on long, I can. But I feel like this has been very important to talk about. And Ashley, please, like I said, please reach out with that information. My contact info is in the chat. So, Beth DeHoff, would you like to jump in?
I would. So I am I'm a financial resource coordinator in the NICU for my full-time job, but I'm also the chairperson of the um, Indiana Governor's Council for People with Disabilities. I'm also active, as Tim is, in the United Methodist Church in disability issues. Today, though, I would really like to share a couple of bills that are on the docket that are of concern to our families. The Governor's Council is involved in collecting family stories to support advocacy around Senate Bill 30, which is the bill that would mandate adult changing tables in all state restrooms, specifically in state rest areas. There are a lot of families who have um, adults in wheelchairs and other mobility type things that make it really hard to change them in a public restroom. So that's one. And then we are not involved in it, but the family sort of community is very involved with HB 1689. And that bill is called Human Services Matters. It would provide a Medicaid ombudsman for people with disabilities. It would provide a new level to structured family caregiving for extraordinary care, so a level 4. And it would allow attendant care for LRIs, which are legally responsible individuals, which are typically parents or guardians, to have at an hour limit attendant care paid for their families. This is important because most of these children who utilize these programs are extremely medically complex. And finding nursing services so those parents can work are extremely limited. And so this is a solution for trained people, which would be parents, to provide that service, which would allows those really complex people to stay at home instead of an institution, because their families can support themselves and stay with their family member. Absent this, if they have to go outside the home to support themselves and they can't find nursing services, that highly increases the risk of institutionalization. So these are a couple of bills that we are following and concerned about. And we don't lobby in the Governor's Council, but we do provide information to families and individuals with disabilities who can do their own advocacy. So those are I'm not going to take all the time with all the things, but I think those bills are important.
They are important. Thank you for sharing that. Also, again, please send me stuff that you want me to send out. And thank you for bringing up legislation, because I forgot to mention that there is a piece of legislation that will be introduced this session called the So Everybody Can Move bill. And that is to require any Indiana insurance companies to provide coverage for not only prosthetics for amputees to be able to ambulate, but activity specific prosthetics, so that if they need to be able to shower standing up, they have a leg that will allow them to do that. If swimming is a major part of their life, they can get swim legs covered by insurance so they can continue to swim or run or do whatever prosthetic they need to help them with their exercise and their activity. So keep that in mind. I've asked the State Independent Living Council to get involved in support of that as well. However, at their public meeting, they did not bring it up in their new business. So just keep an eye on those things. Jill
Yeah.
Edwards, would you like to jump in? Unless anybody has any questions for Beth. Anybody have questions for Beth? I keep forgetting to offer that. Okay. Jill.
Sure. All right. Well, I'm Jill. I'm with the library. I set up programs for adults throughout the Indianapolis library system. And so that includes, we've just started a caregiver support program that has two components. One is chair yoga that prioritizes caregivers, giving them a space to connect and decompress a little bit. We also have a concurrent social hour that's for anyone, but includes folks who maybe are receiving care and not wanting to be home alone or whatever the case might be. It's especially valuable this time of year. However, this time of year has proven it all a little difficult because of the weather. The extreme cold has made it so that people just understandably can't get out. So we're we're keeping on. But we expect it'll be, the weather impacts all of that. I did think another chunk of what I do is I manage the seed libraries throughout the Indianapolis library system. We take bulk seeds and pack them into single household amounts. And in particular, um, volunteers do that. That's how it's possible to be able to share that with everyone. We have a lot of volunteers who have varying abilities and skill levels and can adapt in a lot of ways. And so, if you I looked up as we were talking because one of the really nice perks of that is we have special events where people pack the seeds, and it's a great socialization opportunity, especially in the winter when there's limited opportunity to get out. We have one this Saturday. So I'm going to put a link in the chat to all of them, but there is one this Saturday if you want to come out and see me in particular, and know that we've got the ability to just adapt um, whatever roles there are. I will footnote that and say it's at the Spades Park Library, which is not the most accessible place. It is technically accessible, but if you have someone in particular who's going to have some physical challenges with mobility or sight, let me know because there is a way to get in. But knowing that you're coming, I can accommodate better rather than you having to wait out in the cold for somebody to get to the right door and all of that nonsense.
Right.
Please do reach out and please do consider that because people need to connect to each other quite a lot right now.
Thank you very much. I appreciate that. Any questions for Jill? All right. Carlos, I saw you put a comment in the chat about the fact that the ADA does apply to shelters. Would you like to jump in, talk about what's going on at Eskenazi, and expand on that if you would like?
Uh, Thanks, Jeremy. And I apologize. I will have to go have another meeting
Do it.
when I finish this. But yeah, no, I just thinking about the what was shared earlier, and how the ADA applies to, public accommodations and public spaces, and the shelters are for the public. So I just wanted to find something to which I was able to specifically address emergency shelters. So I just provided that link. Hopefully that'll help someone. But no, I'm with the Gregory S. Ferrybox Center at Eskenazi Health, where we provide paid internship opportunities to degree-seeking college students with some form of a physical disability. We are in the planning phase right now for our summer program, and yeah, everything's going well. We at Eskenazi Health, we just started a new employee resource group for employees with and people at Eskenazi Health who either have a disability or want to learn more about um, being supportive with to employees with disabilities. So looking forward to this new year with this new ERG. I think those are all the updates I have.
Thanks, Carlos. I appreciate it. Sorry for keeping you till the end of the hour.
Oh,
Please,
no, you're fine.
please say hello for me to everybody with connectability. I appreciated the opportunity to help you guys launch that. So
Absolutely. Thank you so much, Jeremy.
thanks. All right. David Love, you've not been on for a long time. It is good to see you again. Sorry, we have very little time. I also need to get through you and Kindle as well. So
Okay.
jump in. What's going on?
Well, I'll keep it very short then. So I'm from Center for Interfaith Cooperation. Put it briefly, what we do is we create spaces for people to have conversations and learn from each other about their various religions, and with that more knowledge, create more empathy, and hopefully thereby more peace. And you mentioned DEI concerns, and like, well, still doing what I'm doing.
Yep.
Same here. And, religious diversity is something that is also a lot of people don't really recognize that under the DEI label, but it is a type of diversity. And I actually have a question for the group. um, and so one of the things that we're doing is we're working with the Hendricks County Community Foundation to have a series of religious diversity workshops at Made at Plainfield. That's the location. Um, the first Wednesday evening of every month, February through November this year. And sometimes it'll be a panel discussion, sometimes it'll be something else. The first one's panel discussion with a mother and daughter that are Hindu. And each month is featuring a different religion that's here in central Indiana. But one thing that we wanted to do, and we're not sure where to go or how exactly to go about it, is we wanted to involve captioning in some way for the hard of hearing and the deaf. And so I was wondering, does anyone know of an organization or person or service that does live captioning? Possibly, essentially a stenographer with a screen that like special section for the people that need it sitting right there in
Sure.
front of it.
So I have learned that that is more often referred to as CART services,
Okay.
CART, which I'm not sure, but I think it stands for captioning in real time. Um,
Okay.
but but I could be totally wrong on that. Sonia put in Relay Indiana as a suggestion. I was also going to suggest DHHS, reaching out to them, and that's and then the other my other thought would be Easter Seals Crossroads assistive tech department to see if they might know who to connect with from that angle. So that would be another option. So
All right.
um,
Thank you.
yeah, and I have a contact with DHHS that I can email you separately. So I
Okay,
just
that'd be perfect.
so um,
Here, Indiana is another group that might have some ideas about that.
What was that
okay.
one? What was that
Here,
then?
Indiana,
Here. Hearing.
HEAR,
All right.
Indiana. It's a nonprofit that serves the deaf and hard of hearing community.
All right. Perfect. Thank you.
Thank you,
I knew you
Kindle.
guys would know.
Right. No, that's great. Anybody got anything else that they want to share with David or any questions for David before I ask Kindle to jump in at the end? Nope.
All
All
right.
right.
Thank you.
Kindle, you want to jump in, tell us what's going on at Noble, and then if folks can stay on for just a few minutes, I have two last things that I want to mention, and then we can be done for the month. So, Kindle.
Hello, I guess I'll just limit it to our parent cafe. So Noble's a full service agency that does a variety of services for people with developmental disabilities. What I'll talk about today is our parent cafe. We've just came off a really successful parent cafe. So we have a group that focuses on parents with children with disabilities because it is sort of a different parenting experience. And the parent cafe is a chance for those parents to get together. We provide childcare so they have an actual couple hours where they can talk. Um, and we'll provide a meal and guided conversation. So it is a chance for parents to rely on other parents, to network, to get advice. And again, we're focused on parents of children with disabilities because it's a completely different parenting experience for some. So just let you know that I put a link in for the uh, Family Support Network. Our link for the next cafe, which will be March 19th, is not there yet. So it'll be coming up. Um, That's what I wanted to get in as quickly as I could.
Thank you very much. I appreciate it. Any questions for Kendall? All right. So the two last things that I wanted to throw in that Walking Spirit is working on, and this will be my primary focus for the year, aside from the random public speaking opportunities here and there, which I am thrilled to get to go speak to two hospitality classes at Purdue Northwest at the end of the month to talk to them about incorporating accessibility into the work in the hospitality industry. And beyond what the ADA says they have to do and understanding what that is. But so the two main things I'm going to be working on, the primary right now is a training unconference for people with disabilities in Indiana about being a person with a disability. Everybody Counts Center for Independent Living was awarded some money from the federal government for the purpose of training people up in Indiana. And so they are wanting to pay for this entire conference, including the rooms and food for the attendees, as well as their parking. So we are looking for 50 people with disabilities, specifically people who are not in the know, who want to become more active in the leadership within our community. And so if anyone knows somebody who, maybe they're new on the path of disability, maybe they have spent their life in an institution and a center for independent living has just broken them out, who knows? But if you know anybody who wants to learn about what it means. What was the advocacy work that went into getting us our rights? What is the advocacy work that still needs to happen? What are the organizations, state and federal, that are supposed to be supportive of this, and how do we hold them accountable to what they're supposed to be doing? Um, Please send that person my direction or send me an email and let me know to contact them. We are working on an online application form for the conference. The conference will be August 27th to the 31st. Once I have that online application form set up, I will send that out to folks and make you aware of it. Beth has a question. She put up her hand, or she wants me to send it to her.
Yeah,
Which is,
I do have a suggestion. As
uh,
you're looking for people who aren't, I just love that you want people who have not been engaged in the systems yet. And some thoughts about that are to look in the communities that we don't usually see people. The disability world is overwhelmingly white and middle and upper class. So people in poor communities, people who are part of a marginalized community, our Black brothers and sisters, our Hispanic brothers and sisters. Um, that's one thought I had. And then the other thought I had is to try to include people with severe disabilities who may not be able to communicate.
mm,
And if you want to do that, you're going to have to include their support person in the conference. So you have to think through if that's okay. But
right.
we often shut out our people who have the most significant disabilities. And because of that, they often aren't considered when advocacy messages are built.
Right. Yeah, I would love any thoughts you have on how to connect with those individuals and to find those folks who need that. Because
It's
that's
my heart passion is people with the most severe disabilities. So
right.
I'd be happy to help.
Right. Right. Thank you. And yeah, that is, we are wanting to go outside of the box in regards to finding the folks to the attendees for this conference. And we are trying to figure out how we fit in caregivers into that situation. Because as we looked at it, paying for the food, it got really expensive to pay for everyone. While we recognize, we want to pay for the food for the attendees, if caregivers are traveling with them and need to be in the sessions, then we'll figure that out. But um, but if they're just
Um,
traveling with them and are
and
hanging out in the room, then yeah, we're not going to include them in that part.
let's let's talk. Governor's Council has some grant funding available to people. organizations who are working for people with disabilities. So
Okay.
I don't know of a specific grant opportunity for that, but let's just talk offline about it.
Absolutely. The other thing is, and this may or may not happen. When they initially retained me to coordinate this event, they also wanted me to coordinate a celebration, a public statewide celebration for the 35th anniversary of the ADA, which happens on a weekend this year. So we were looking at Military Park to do that. However, there is some hesitancy because last year when we did the Rally for Disability, Freedom, and Justice, the community didn't show up. And so I mean, we got the press there, we got people from government offices there, even representative from Andre Carson's office, and but the disability community itself did not come. And so I need to gauge interest and again partnership opportunities and things like that. So if you guys can take that back to your organizations and if anybody says yes, we want this to happen, we want to show Indiana the disability community and why the ADA is important to all of us, beyond just the disability community, but anybody who at any moment could become part of that. So I would love it if you guys could help me gauge public interest in doing that event. And if I am able to say to everybody counts, yes, the public is interested, the community will show up this time, then I believe I'll get the green light to move forward with planning that. So, um, so yeah, if
Do you know
anybody,
the date?
well, the date would be July 26th if we were able to do it, because that's the
Okay.
actual anniversary, um, of the ADA. And I believe, yes, this year that is a Saturday. So,
I'm just wondering
Um,
if we get involved, like groups involved, like Down Syndrome Indiana invites their families. Self
mhm.
Advocates of Indiana makes it a group event to go, you know, that kind of thing.
Right. And that, so yeah, on the conference, the training that I think everybody counts wants to keep specific to the funding that they were
No,
provided.
I meant your
But
ADA event.
but on the
Mhm.
ADA event, yeah, we are absolutely open to partnerships and getting different groups involved. So please, yeah, help me gauge interest. And I think it's important. I think it's something we
Hmm.
do. So,
I strongly agree. I would also like to point out just because, in my role, because I'm very community facing, that I can keep you abreast of other things because sometimes those weekends in July get so crowded with back to school events and everything else that's going on. So I would love to, as soon as we get everything together, to get a flyer to help promote it. I want to be there and I would love to push it to our members and just to the general public. Um, but I think that with last year, what may have been was just sometimes it's just overcrowded with events, especially in certain parts around central Indiana, and that people are overwhelmed sometimes with how many things are going on. So they're just picking the first thing or what's nearest them and not taking out the time to come to downtown Indy or any of that. So I definitely want to participate.
okay. Chalicia, you were not on at the beginning, and I didn't notice when you joined us. Adam jumped in for Care Source. Did you have anything you want to say before we wrap up?
No, I was just so happy with the outpouring of information for Ashley after she shared her part because yeah, I met with her and I was like, "Hey, you know what?" After she shared that, I said, "Oh yeah, I got the perfect group for you. I know where you need to be." So yeah, so I'm happy that everyone was able to give her information that she needed and that you all will touch base with her outside of this meeting because we have a lot of things in the community we need to address and there so many overwhelming changes or hints of changes that are taking place right now. So I'm just trying to offer as much support as possible. But yeah, Adam said enough. That was
Okay,
that was it.
very good. Thank you all. Please have a great month. Please send me things and yeah, I mean, we do. We have a lot of work ahead of us to keep what we have and to push forward on what we need. So let's really coalesce this year and make our voice as a community known. So, all right. Thank you to you
Thank you.
all. Yeah,
Thank you,
Jeremy,
Jeremy.
bye.
it's a pleasure to see all of you. Thank you so much.